patella poking straight forward where my arrow is. Do you see that?
Yes.
Yeah. So this is the medial aspect of the patella right there.
Good morning. Happy Friday. I have Neuro Coffee in hand and it is perfect. All right. Man, looking forward to a busy weekend, actually. We're inside a week for the Intensive 13 people, so they're wrapping up their preparatory work for next week. And Intensive 14 has just started working on their stuff, so very busy with that. Digging into today's Q&A. This is another segment from yesterday's Coffee and Coaches conference call, which was really good and incredibly fun. A lot of laughter went on yesterday, so we had a good time. But this is from Alex, and Alex had a question that built off of something that we were talking about on IFAST University in regards to some knee orientation representations. So I actually threw up a visual representation of some of the stuff that we talked about in regards to some of the orientation, especially at the knee where we have femur going one way, tibia going the other way. So you actually get to see this a little bit, and so we kind of talked through that. I think it'll be useful for a lot of people to gain some understanding as to what can actually potentially occur in some of these knee situations. If you would like to participate in a 15-minute consultation, please go to askbillhartman@gmail.com, askbillhartman@gmail.com, and put 15-minute consultation in the subject line so I don't delete it, and we will arrange that at our mutual convenience. Everybody have an outstanding Friday. Have a great weekend. We'll see you next week.
In the IFAST post, there was an IFAST post like 5 weeks ago where you're talking with George about like knee mechanics and how you determine like twists of bones. And one of the things that you mentioned was if you have proximal tibial ER and then you have full knee flexion still, that's indicative of a distal IR twist. Because it's a concentric vastus lateralis and eccentric VMO.
Mm-hmm.
And I can't really visualize it because to me, a distal IR femoral twist puts you more towards screw home, which would make knee flexion still harder.
Exactly. So, it shouldn't happen. That's the issue, right? Because it should put you in screw home. It should be a limiter of the knee flexion. But when you get somebody that has like fully compressed heel to butt, it's like, okay, if you've got tibiofemoral ER and distal femoral IR, it's like, how are they doing it? And the reality is if I have eccentric orientation of the VMO, okay? So VMO attaches from the patella to the adductor, right? And that space, so that if that is eccentrically oriented, that means that the fluid volume that is inside the knee has a space to move into, which allows knee flexion to occur in a tibiofemoral ER relative position. That shouldn't happen under ideal circumstances if we're talking about knee behavior.
So how do you differentiate? Because if you just have like a twist into proximal tibial ER, that should also limit knee flexion. So how do you differentiate?
Keep going.
I feel like maybe I just, and so if you have proximal, the only way between just the situation of proximal tibial ER and proximal tibial ER plus distal femoral IR, only that one is going to give you full knee flexion because you have to have the eccentric orientation somewhere.
Yeah, so whenever you see mechanics like that, and you'll see it at the elbow, right?
Yeah.
Just like you would at the knee, it's like you should not have that range of motion available to you. The other thing that Alex, there's like, so you've got some visual contributions here. So when you take somebody into full knee flexion that shouldn't have it because of the tibiofemoral twists, the patella is going to ride laterally big time. because think about the pull that you're getting from the distal VL is gonna pull that patella right out off to that edge of the trochlea. And have you ever seen the downward X-rays that they do for knees, where they put them in a little bit of knee flexion, and they do a superior to inferior view of the knee so they can see where the patella is resting in the trochlea?
Yeah.
Okay.
It'll be,
Yeah, you'll see it a mile away that the patella is resting way lateral, and it's got the big heavy tilt on it.
gotcha.
And all it's doing is it's just following where the train track goes. It's not the patella's fault. We got to stop blaming the patella for things, because the patella's an idiot. Seriously, it doesn't make decisions. It's just following the track.
Yeah, I mean, that makes a lot of sense.
Yeah.
So I used to look from behind at someone's knee and use the like the insertions of the hamstrings to determine whether or not there was just IR of the whole femur.
Yeah, it works great. I posted a picture yesterday on that.
Oh, did you?
Not
okay.
probably not one that you can see, but I did post it somewhere.
Okay.
I can bring it up. Hang on, I can bring it up. So look at the anterior representation first, and look at the left leg. It's a little bit easier to see. I mean, both are torqued, but the left one is really strongly turned. You see the prominence of the medial femoral condyle in the left knee.
Mm-hmm.
That's what that is. That big bump on the inside of the knee is the medial femoral condyle. And then if you look at the left leg in the middle representation, you can really see the musculature twisting around the femur. Do you see that?
Yeah.
I mean, that's so. And you talk about like the hamstring twist. Look at the tension on the biceps femoris. And then I did a little bit of manual stuff just to show a little before and after. And you can see that you start to get the untwist. So you see all that muscular tension that was behind the knee is starting to disappear. And then her knees are starting to level out a little bit. Go back to the first representation anteriorly. You can even see the patella riding laterally. You see the prominence of the patella poking straight forward where my arrow is. Do you see that?
Yes.
Yeah. So this is the medial aspect of the patella right there. Look at all the concentric orientation you have. So you can see it in both VLs, the concentric orientation. So you see this big dent right where the VL comes down and inserts into the quad tendon. You see all that muscle activity there, but this is a pretty cool twist, and you can see the difference in the two thighs quite a bit as far as how much turn you do have. You look at this proximal, just follow rec fem. It ends up pretty lateral on this left anterior thigh. So this is a really good example.